Well, hello, and thank you so much for joining us. I'm Dan Edwards, and yes, another exciting Kettering Health Facebook Live chat. And we're getting real in real time. Great to have you joining us here this evening. Our Kettering Health Facebook Live chats, as people are logging in now, we want to get your questions. It's an interactive forum for you to kind of ask questions of our Kettering Health expert this evening. In today's topic, so you know what questions to ask, certified nurse midwife and their role in your health. From puberty to menopause, they can take care of all of your health needs. And it's a really kind of an exciting field. And so for the next 28 minutes or so, we're going to be talking about this. We will deliver important facts to you about this topic, okay? So please weigh in now with any questions you might have about certified nurse midwives, or midwifery as it's called. Now we want to get to as many questions as possible, so go ahead, log in, get your question in there, and we'll get this to our experts. So again, get those questions in the chat box, and if you have any questions related to today's topic, certified nurse midwives, don't delay. Let's chat, shall we? It's like a free house call. It's a free consultation for you. And let's welcome our Kettering Health expert, Kelly Welsh. Kelly is got a few acronyms around here: APRN-CNP/CNM. The last one I know is a certified nurse midwife, and she's board certified nurse practitioner and midwife. Kelly has many years of experience providing a full array of women's health services from early teen to postmenopause, and she's trained in all areas of contraceptive options, as well as providing individualized and compassionate prenatal and preventative health care. And Kelly attends low-risk births at Soin Medical Center, serves as the lead advanced practice provider for Kettering Health Women's Services, and sits on the Montgomery County Infant Mortality Task Force, among other boards, which we'll talk about. And Kelly's goal is to always provide the best experience for her patients. And she's happily married with 3 children who all enjoy attending the University of Dayton men's basketball game. So thank you so much for your patience, Kelly, as we set things up. Great to have you with us tonight.
Thanks so much for having me. I appreciate it.
Well, tell us a little bit about, as people are weighing in and getting their questions into the chat box right now about this topic, tell us a little bit about your journey. How did you get to where you are, Kelly?
So I've spent about 13 years in the women's health realm. I started as a labor and delivery registered nurse at the Kettering Health Network. And then I decided I wanted to be a certified nurse practitioner. So I went back to graduate school and I did that. And I worked primarily in women's health. I did prenatal care, all the things you talked about in your introduction, except for attending births. And so more recently, over the last year, I went back and got my postgraduate degree in nurse midwifery so that I could do the full spectrum of women's health care. So in 13 years, I've kind of come full circle there.
Wow, that's nice. Well, very cool journey. Where are you from originally?
So I actually was born in Pittsburgh, Pennsylvania, but I have been in Ohio for, 40 years or so.
Okay.
So primarily Kettering, Ohio is where I grew up.
Yeah, then you had this great opportunity at Kettering Health and you decided to take it. So
yeah.
How long, so you've been in the Dayton region for, you said probably 40 years or so, right? So are the kids enjoying their summer?
Yeah, so I have 3 kids. Yeah. I will have 3 kids in college actually starting in the fall. So
I got to ask you, are you a Bengals fan or a Steelers fan since you were born in Pittsburgh?
We are definitely Bengals fans.
Well, I got a feeling you're going to see a lot of Bengals paraphernalia with Kettering Health as they are now the official provider of the Cincinnati Bengals.
That was great that they did that.
Yeah, yes. My wife works at Sycamore and she's already gotten the t-shirts and everything, which is okay, but I'm a Browns fan. But hey.
You are.
But I'm glad that they are the healthcare provider of the Cincinnati Bengals. That is pretty cool.
Yeah.
All right, so another fun fact about Kelly, this is her first Facebook Live chat, right?
Yep.
All right, so ask her some easy questions tonight if you would. And remember, do so in the chat section. Please share your questions and we'll relay those as much as we can here to Kelly as time allows. And let me ask you, there is a show that you can stream called Call the Midwife. It's in 11 seasons. Do you ever watch that at all? Or?
So I actually have not watched that, but I get that question a lot. It's back a very long time ago.
Right.
You know, they're kind of depicting the midwifery scene back then.
Right,
I really need to see that, but long ago, it was a lot of midwifery care. And we sort of got away from that for some years. And now we're sort of, the midwifery scene is coming back a bit. I'm seeing it more and more even in the Dayton region.
Let's just start right there, though, Kelly. The obvious question, in today's modern medical world, what is a certified nurse midwife?
So, and I'll say the difference is, you know, we talked about the schooling. So we talked about a midwife goes to get their master's or doctorate degree. Where in OBGYN, we work in collaboration with. They go obviously to medical school, they go to residency, they also attend births. So I guess I would explain what a midwife is we are primarily concerned with low risk, normal term births. More of a natural approach to the birth versus an OBGYN who's actually surgically trained. So we need to work hand in hand with them as a team. So in the case that we need some intervention, for a high risk condition, then we have that. We have those physicians as backup. So we kind of need to work together hand in hand. So in saying that, a midwife is more of a low risk, low intervention process. And I think, you know, doing less episiotomies, for example, trying to lower the rate of episiotomies, lowering the rate of C-sections. So looking at infant and maternal mortality. And so, you know, what can a midwife bring to that setting and bring those statistics down?
So is it more of you're kind of, you have the medical training, obviously you have to go get your master's or doctoral, but you're kind of like a coach almost? I mean, kind of being that friend to hold the hand, not that the doctor doesn't, but with a midwife, different skill set.
Yeah, so there are two different perspectives, I suppose. We come from a nursing background, nursing into midwifery, and then there's the medical background. They both can do similar things, but you're right. I think we tend to be more at the bedside. We tend to be more with, you know, midwife means with woman. So we tend to be with women throughout the process, probably a little bit more. Putting women in different positions, making sure we can get that baby down into the pelvis and things like that.
Let's talk with you now about, let's say that there's a young lady out there, this is her first pregnancy. My gosh, that's got to be, you know, it's got to be a scary time, particularly when you're younger. Share with us the expectations that they can expect.
Sure. So what I would recommend is prior to getting there, so they're thinking about getting pregnant, I would start taking a good prenatal vitamin, probably about 3 months before they get pregnant. Something with folic acid. Now all prenatal vitamins have folic acid in them. That helps prevent neural tube defects. At least 400 micrograms. Some have 600, some 800. If you're a higher risk person, we might ask you to take more folic acid. That's one thing to start with. Also, being as healthy as you can prior to coming into that pregnancy, meaning being at the best body mass index that you can be. Exercising 30 minutes a day, at least 5 days a week. So 150 minutes or more per week. A couple, you know, nutrition, really focusing on, you know, good proteins, fats, carbohydrates, getting the best nutrition you can. And if you have some of those chronic health conditions, things like hypertension, are you on the right antihypertensive medication if you should get pregnant? So there's some that we don't want you taking while you're pregnant. So it's best to get on the right antihypertensive that are safe in pregnancies. Diabetes, making sure your hemoglobin A1C level is at really good level prior. So really any of those chronic health conditions, having things in check. Immunizations, making sure those that we can get done prior, that we've gotten those done as well.
Yeah. We've got a question here from a young lady. She says, I'm set to get induced tomorrow night.
Yeah.
My question is, when should my milk typically come in if I'm induced? And is there a way to speed it up after I have him? So congratulations on the upcoming birth process.
Yeah.
That's awesome.
So maybe
what would you say, Kelly?
Yeah, so maybe I'll see you tomorrow, but
let's hope.
Yeah, so your milk tends to come in anywhere on average from day 3, 4, or 5.
Okay.
Ways to possibly speed things up, and we tell you this in the hospital while you're there for that 24 to 48 hours. You have lactation support there for that whole entire time. Breastfeeding in the first 30 to 60 minutes and frequently. Cluster feed is very, very normal. It's not going to be you're feeding the baby every 3 hours. It's going to be I'm feeding the baby for 10 minutes and then a half hour later feeding the baby again. So it's as frequent as you can breastfeed, and also drinking your 80 to 100 ounces of water. Continue to do that daily. That will help bring that milk in as well.
Another question, should I take my pump to the hospital when I go deliver?
You don't need to.
Okay.
I don't know what hospital you're going to, but my experience has been you don't really need to bring your, we have manual pumps there, and also electric pumps for you to use.
So the midwife is there from basically day one, or that first visit with their obstetrician?
Yes. So when you learn of the pregnancy, you take that first pregnancy test and it's positive, you're going to call your provider, you're going to call the office, you're going to make that appointment with either that OBGYN, that physician, or the midwife, or both. So a lot of times, especially in our practice, you're seeing a little bit sprinkling of both.
Okay.
Go ahead.
No, I just wonder how many midwives do we have? Let's say like at Southern Boulevard at the main campus. Do you know?
So as far as Kettering Health, we have 5 midwives right now with a 6th coming on. We are only delivering at Soin Hospital in Beaver Creek. So we're going to have 6 here soon, hopefully with a few more to come as we grow. And Soin is really where we're doing a lot of midwifery care. Midwives do a lot of the vaginal births over there at Soin Hospital.
I understand we have like 1% of men who are midwives in our country too, so that's an interesting fact I saw.
Yep.
Well, you work closely with the obstetricians and the gynecologists, but you can also do routine exams, correct?
Correct.
Okay.
So, you know, anything in the office, or most everything in the office, we're not surgeons, but we can do procedures. We can do pap smears, annual exams. We can work up, you know, abnormal uterine bleeding. We can do endometrial biopsies, colposcopies, all kinds of things in the office.
Okay, well let's talk a little bit about postnatal care before time gets away from us here, Kelly. Any tips that you can share with us there?
So you're gonna get, like I said, a lot of information in that 2 days. I would recommend people, especially with your first baby, to stay in the hospital either that 2 days for a vaginal birth or 3 days for a cesarean section, just to get that extra education. We're gonna go over things to look for when you go home. If your bleeding increases, your pain increases, you have fever, chills, you know you need to follow back up with us. Postpartum depression. I mean, we could talk a very long time about postpartum depression, but it can happen in up to 20% of us. So, you know, signs of that, having thoughts of harming yourself or others, that's an immediate emergency department visit there.
So, how many births do you have at Soin? I mean, how many have you done this year, so to speak? I'm just kind of curious how many
Yeah, so
midwife.
as a whole, the midwives are delivering, I don't know the exact number, but 500 to 600 per year.
Oh my!
And we're growing in number, but it's really great, and it's the best experience ever to attend those births. We have 6 labor rooms at Soin Hospital.
Yeah.
We have a tub over there for you to labor in the tub.
Right.
Very holistic approach over there.
Talk to me about that, Kelly. I mean, what is that like for you personally to be a
Amazing.
part of this amazing process?
It's kind of indescribable, but it is the most amazing experience to be that first person to, lay hands on that baby and pull that baby up. And, even at this point, a lot of people aren't finding out gender, so we get to tell them
Oh, how cool.
gender, which is it's really neat. It's a great experience. I also wanted to mention we do have backup protection. We're there in the hospital 24 hours a day, 7 days a week. We also have an in-house physician who's there 24 hours a day, 7 days a week. If we have an emergent issue, we have a physician there if we need to intervene in 3 minutes.
Excellent. Good advice, and good to know that. Can CNMs be in private practice?
Can we be in private practice without a physician? So in the state of Ohio, we need to have a collaborative physician. So the answer to that question is we can. We just have to work, and we want to work in collaboration with a physician. We need that backup in those emergency type situations. So I think what you're asking is, can we have our own practice? There are midwife groups that have those practices, even in the state of Ohio, but they always have a backup physician, even if they're not in the building.
We have another question here, Kelly. Someone writes in, I had a uterine ablation after a biopsy to slow or stop heavy bleeding. She said it never helped and has really picked up worse, cramps are worse. It's been a year. She's asking, should I schedule another one or consider a hysterectomy? That's a tough one.
Yeah, so in 85% of uterine ablations, they work very well. They stop the bleeding, stop the cramping. Those other 15%, unfortunately, it doesn't work for. So yes, sometimes we are looking at a possible hysterectomy.
I understand.
I would schedule with a surgeon for that as well.
What's a doula?
So a doula is a support person for the laboring patient. So they hire these doulas. I want to say, I don't want to speak to what their training is, but it's maybe a couple months of training that they get and how to best support that patient in the labor process. So they're kind of the aides. They help us in that process, and they fulfill or help fulfill that mom's needs. So sometimes they have a birth plan and abiding by that birth plan.
And you, as a CNM, you can go to their home and deliver, correct? Is that what you said?
So none of us do that
Okay.
as far as in the Kettering Health system. There are midwives out there that do that, but generally speaking, certified nurse midwives do not.
You know, we're in a time now where breastfeeding seems to be in a lot of the newscasts now because of the shortage of the supplements and such. What advice can you give us on breastfeeding? Any tips on that if someone's thought that they were going to go with formula, but now they're thinking maybe I should do it naturally?
Right. So there is a breastfeeding outpatient clinic that we have that is phenomenal. It's been around a long time. So when I discharge a patient from the hospital, I make sure they have that information. If they're struggling with a latch, with supply, call, and I think there's a slide that you'll put up, but call that number. They're very good over there. They'll spend a good hour just working with you and your baby and the breastfeeding, There's a lot of different techniques, a lot of different ways that we can help this process. Back when I had kids, we didn't really have that, so it was a lot harder. Breastfeeding is challenging. So, seek help. Definitely use the resources that are there, for sure.
Another chat question here. How soon can you be active?
So, after having a baby, typically, we want you up and active as soon as your epidural, if you had one, wears up, we want you up moving around.
Okay.
Yes. If you had a natural birth, as soon as that baby's out, we want you up moving around.
Wow.
It's to help prevent blood clots. We want that blood circulating and things like that. We don't want you just laying in bed, but I also don't want you out running a marathon 2 days later either. So
there are some women who would do it though.
Yes. But
you're not going to be slowed down.
Time to heal, time to breastfeed, time to, care for your baby and things like that.
All right, another chat question. What happens if the unexpected happens?
So, if the unexpected happens, and that can mean a lot of things, right? Are you meaning if a cesarean section is to happen, or are you talking about after birth?
Right.
Which,
after birth, yeah.
If the unexpected.
Let's do both. during the session and then after.
So if the unexpected happens and say a patient really is, they have a birth plan and their journey is to do a natural birth, in a lot of cases, those work out just fine. But I always tell moms the ultimate goal is healthy mom, healthy baby. And so if we have some high risk conditions that are going to warrant the need for a cesarean section, we're not going to take that lightly. We're going to go over all the risks and make sure she's comfortable with that, but sometimes there's some urgency there.
Sure.
What I try to do is talk to them about that early on, perhaps when they're coming in, when they're, in early labor, getting induced, that if this should happen and you see us moving very quickly, so that they're educated and we have a shared decision making should that occur. I work really hard to try to make that happen, but sometimes the unexpected does happen.
Yeah. Well, you're in the best possible hands if it does. A question that I have, I remember my wife, she was breastfeeding and it was absolutely wearing her out. It's a lot and it takes a lot out of the mother. So how do you care for yourself when you're caring for a newborn?
Yeah, and a lot of parents have a hard time asking for help, right? That would be my biggest advice. Napping when the baby's napping.
Right. Critical. Yep.
A lot of us don't do that. We want to do the dishes. We want to,
fold the laundry.
But then you're exhausted.
You sleep when the baby sleeps.
Right.
Yeah. Best advice I've ever gotten.
Exactly.
Well, not me, but my wife.
Yeah. Hand the baby over to your partner for a while. Take a walk. Get some fresh air. Those sorts of things.
Just take time for yourself.
Exactly.
You've been through a lot, man. There's no question about it. Can we take a look at your team? If not you, you've got a team of midwives that we'd like to celebrate right now.
Yeah, absolutely.
A lot of experience there.
Yeah, this is such a great team. I'm proud to share this, and they have been around longer than me. So I am the newest midwife here at the practice. But we have some great midwives with a huge plethora of experience. If you should want midwifery care, Kettering Health has right now 5 of us. Like I said, we're getting a 6th one here soon. But you would call Advanced Women's Healthcare. That's where we're located. We have multiple physicians, and you see all the midwives here. We also have 3 nurse practitioners in our practice.
Yeah, that's great. You're in good hands there. And you're also part of quite a few boards, like we mentioned, the Dayton Area Infant Mortality Task Force. Is some of the other boards that you'd like to mention, to give them a shout out, let them know that we're working on this issue?
So the infant mortality, Montgomery County, since I just moved about 7 months ago from my previous practice, I'm no longer on that one, but hoping to be, more of the Greene County, since I'm in Greene County now. But infant mortality is a problem nationally and in the state of Ohio. So it's a passion of mine to continue to work on reducing infant and maternal mortality rates in Ohio.
Yeah, is there anything we can do to help you in that endeavor?
It's a lot of just education. Birth spacing is a big thing. Helping to prevent preterm deliveries. Well, how do we do that? And this is one thing I failed to mention when you asked me about aftercare. Birth control. Birth control, we want to space 18 to 24 months in between pregnancies. That helps reduce our preterm birth, and in turn helps reduce our infant mortality rate. Because one of the biggest reasons for the infant mortality, and again, that is the when an infant dies within the first year of life. That's the definition of infant mortality. Our rates are not where we want them. When we have a preterm delivery, we have an increased risk of that baby dying before their first birthday. So if we can birth space, if we can use good contraception, long-acting contraception, things like IUDs, things like implants. People have heard of Nexplanons, intrauterine devices, or even just good, they're all good forms of birth control. It's not a one-size-fits-all. But I think it's just getting the word out. To answer your question, education, things like that. Hey, we don't want you to get pregnant in 6 months after you deliver, because you have an increased risk of delivering that second baby early.
Are births up in our region?
I don't think so. I think I'm actually hearing they're a little bit stagnant right now, which is actually interesting.
Yeah, it is, considering we've come through a pandemic and a lot of time on our hands.
Yep, exactly. So we'll see what happens next year.
Well, that's good. Well, listen, it truly is a labor of love, what you do. I mean, in a literal sense. I mean, it is. You have found your career path. What would you say to a young lady out there who is contemplating a career in medicine, enjoys babies, the obstetrics and those type of things? What would you say to them, and how would you prepare them for where you are today?
I would say, gain that experience at shadow as much as you can.
Shadow.
So, my daughter is looking to go to med school. I think she's interested in this field, and she's shadowing multiple specialties. Right. I think you have to really be there to see, this is what they do. And with birthing, you either like it or you don't, is what I found.
Yeah. Well, on a personal note, I was able to see the birth of both of our children in two different forms. One was, I had to be wheeled into the surgery room because it was just at that critical point where we had to do something. And then the second one was naturally. And I can't imagine not being able to be there when that first scream comes out, that first cry is uttered, and those first breaths that they take. Man, it's an amazing experience. And for you to be able to do that, what an office that you have every day.
Yeah. So let me get this straight. You had your wife had a cesarean section first, and then a vaginal
she's very petite.
Birth?
So my son had a big head like me, and he was a face, so it wasn't going to happen naturally.
Yeah.
But she was devastated.
Yeah.
And the second time, she was able to do it the way that she wanted to, and it was such a beautiful process. She was able to participate in it.
That's great. That's wonderful to hear.
Well, listen, Doc, Kelly, we've got to wrap things up here. I really appreciate your time and your expertise. Great information, and the passion that you have for this is just fantastic. And we hope that you'll join us next time for our Facebook Live chat. We're going to be talking with Dr. David Welker, focusing on the topic of foot pain. Until then, it's Kettering Health. We want you to be your best. All right? Have a great summer.